on your time management lists. So there are some real practical things that you have to do, because you will have competing demands on you. And believe it or not, as busy as you feel now, they'll get even more so. And managing those and setting your priorities on the basis of principles. Thank you for the question. Yes? So the question is, what obstacles have I faced in my career in medicine? So one of the things that I now talk about is the fact that I grew up in sort of a different scenario. I was a foster kid. And I can tell you that growing up in foster care is the hardest thing that I ever did. Everything now is easier than that. And so believing in myself when I was in those circumstances was probably the biggest barrier. There have been times when I got treated differently because I was a woman. That will happen to all of the women in this audience at some point in their career. And what you have to do is you have to keep your eye on the prize. Remember what your goal is. Remember what you're striving for, because it's all going to be worth it. I want to end, though, in answering the question by saying that the obstacles that you face are not predominantly because you're a woman. They're inherent in the challenges of becoming a doctor, becoming a leader, and they will be faced by all of the people in this room. And so one of the really important things is to look around at your colleagues, people sitting next to you in this room today, and to support each other. By believing in all of us, we will make it easier for all of us. Yes, please. So the question was about UC Davis and what we're doing about geriatric care. And this is a huge problem in our society today. And one of the values that we put in our strategic plan is to emphasize lifelong care. And understanding that the kind of medical care that babies need is different than adults, which is different than older folks. And so we have emphasized geriatrics. We have a geriatrician, Dr. Michael McLeod, who is a very inspirational leader. One of the realities is that very few physicians go into geriatrics care. So if by virtue of your question, that's something you're interested in doing, that would be something that we would value. Geriatrics care is frankly not well reimbursed. It's complex because people have multiple chronic diseases, which is very hard to manage, all of those aspects of aging. So I think it's a great question. I would urge you to talk to Dr. McLeod about the things that we're doing in geriatrics. And it's something that we as a nation and as a field of medicine have to really talk about how we're going to make sure that people like me, the aging population, get the care that is so needed. So our student-run clinics actually involve undergraduate students at UC Davis as well as medical students, and they're supervised by the faculty like Dr. Jan. And you have to apply. It's very competitive. Lots of undergraduate students want to do it. So there is a process for doing that. You can contact the students. The medical students actually screen the applicants. We also have volunteer opportunities at UC Davis Medical Center and UC Davis Health System and School of Medicine, and those go through our volunteer office. And so those of you who are interested, those are also very competitive. More people want those kind of opportunities. But you should contact us and we'll try and match you up. And Jubin, as usual, is way ahead of the game, and there is a link on the website if you signed up for the conference, he tells me. Yes? So one of the questions is, what role will complementary medicine, or sometimes called alternative medicine, we like the term complementary better, play in the future? This is something that we're very actively exploring at UC Davis. I see this very much expanding at all schools. For instance, our anesthesiology department has a major interest in acupuncture. That's something that we offer. Our physical medicine and rehabilitation folks have an interest in mind-body connections, biofeedback, those kinds of things. And I think when the NIH developed an institute to look at real studies of complementary medicine so that we have evidence-based answers about what really works, that was a huge step forward. Clearly the public wants complementary medicine. This is something they're willing to pay out-of-pocket dollars for. So since the focus is on our patients and what works for them, I see this as an expanding area, and I see it as a responsibility of universities like UC Davis to find the parts of complementary medicine, just like we find the parts of traditional medicine that work, and to give that information to the public so they can make great decisions. Maybe one last question? Yes? Yeah. Yeah. The question was about international students. So at the University of California schools, we have traditionally taken predominantly in-state students because of the funding mechanisms. I think that the most important thing is we want the best students, and so the international students are very much encouraged to apply. One of the things we're doing at UC, and perhaps Dr. Hume talked about this yesterday, was an increasing emphasis on global health. And I think that we understand that there's great expertise from everywhere. And so we urge you to talk to Dr. Henderson. And bottom line is, if you're the best, we want you. Thank you very much. Have a great conference.